Modern surgery, with its precision, hygiene, and anesthetic innovations, is worlds away from its early beginnings, yet its history remains largely untold. In the previous segment, we explored surgery's ancient origins, from trepanning in the Neolithic era and advancements in ancient Greece and Rome to the Middle Ages and Renaissance. Despite the crude, often brutal nature of early procedures, surgery has since evolved into a precise, effective, and safe practice. To understand how it all happened, let's dive deeper into the remarkable journey of surgery, tracing its evolution from medieval practices to the modern operating room. Surgery has started with a gruesome history with early practitioners, often shamans, drilling holes into patients' skulls in a procedure called trepanning to treat ailments believed to be caused by spirits. Despite its primitive nature, trepanning was surprisingly effective in some cases, leading to its adoption across various cultures. The Greeks and Romans developed further surgical methods, like bloodletting and bone setting. Throughout the Middle Ages, barber surgeons carried on the surgical practices, performing basic procedures without anesthesia or sanitation. Gradually, surgical knowledge expanded with pioneers like Guy de Chauliac, John of Ardern, and most notably, Ambroise Paré. However, before truly effective modern surgery could emerge in the 19th century, 4 key problems needed to be solved: understanding human anatomy, controlling bleeding, developing anesthesia, and ensuring antiseptic conditions. Let's explore how some of these challenges were addressed one by one in this second part of the history of surgery. Chapter 1. Anatomy. A surgeon needs a detailed roadmap of the human body to perform surgeries accurately. Before the 16th century, there was minimal understanding of human anatomy. Dissections on cadavers were rarely performed, and as a result, there are many misconceptions about human anatomy. The true understanding of human anatomy began in the 16th century with Andreas Vesalius. In 1543, Vesalius published a groundbreaking book called De Fabrica, which is short for De Humani Corporis Fabrica Libri Septem, or On the Fabric of the Human Body. This book was the most comprehensive anatomy text of its time and became the basis for 200 years of anatomical study. More importantly, it provided descriptions of actual human anatomy, correcting many misconceptions from previous studies. When you look at this work, there are a lot of wonderful illustrations of all the different layers of the human body. Note that this was in the middle of the 16th century, but Vesalius' book looks like a modern-day CAT scan. He has layers upon layers of human tissue, of human organs, and shows what they were. These illustrations allowed people to understand the human body's structure better. He wanted people to be able to look at his book and feel as if they were in an operating room, looking over his shoulder when he was giving an anatomy lecture. Again, Dr. Vesalius was able to gain a better understanding of human anatomy because he was allowed to dissect human cadavers. Prior to his time, this practice had been forbidden for thousands of years due to religious and cultural prohibitions. The church had forbidden it, and in ancient Greece and Rome, they also did not allow it. As a result, there had been no true understanding of the human anatomy for literally thousands of years until Dr. Vesalius' time. And when that information began to be developed, it contradicted many anatomical beliefs about the human body that had descended from Galen, which again was based on animal dissection. Vesalius frequently stressed in his book that Galen's anatomical descriptions were incorrect because Galen had never dissected human cadavers, relying instead on animal dissections. As a result, his study of human anatomy corrected ideas held from Greek and Roman misconceptions. Because of his influential work on human anatomy, Dr. Vesalius completely shifted how human anatomy was understood, making him one of the founding fathers of modern surgery. Chapter 2. Bleeding. The second problem that needed to be solved was controlling bleeding, because during an operation, uncontrolled bleeding can obscure the surgeon's view, making it impossible to navigate the anatomical landscape. Bleeding also significantly influenced patients' outcome after surgery. This problem was solved by Dr. William Harvey, an English physician who was the first to describe in detail the systemic circulation and properties of blood being pumped by the heart to the brain and the rest of the body. This influential discovery was published in 1628 in his work De Motu Cordis, or On the Motion of the Heart and Blood. Before Harvey, individuals had no idea where blood circulated or if the lungs were involved. Harvey's understanding of the heart as a pump that circulated blood through the lungs to be oxygenated and then distributed throughout the body was groundbreaking. This understanding was developed in the early part of the 17th century. At the time of Harvey's publication, Galen had been an influential medical authority for centuries. Galen believed that blood passed between the ventricles through invisible pores, and that the venous and arterial systems were largely separate. According to Galen, the venous system originated in the liver, while the arterial system containing spirits flowed from the heart to distribute heat and life. So of course, Harvey's discovery of blood circulation was incompatible with the prevailing paradigm at the time. He was very much aware of this, and even wrote that his discovery would be met with skepticism, mockery, and abuse. Quote, "But what remains to be said about the quantity and source of the blood which thus passes is of so novel and unheard of character that I not only fear injury to myself from the envy of a few, and respect for antiquity influence all men. Still the die is cast, and my trust is in my love of truth and the candor that inheres in cultivated minds." Unquote. It took 20 years for his theory of blood circulation to be generally accepted. Even after Harvey's discovery, the practice of bloodletting for various maladies continued. Bloodletting involved incising a vein and allowing blood to drip out, often in large quantities. We're talking about literally up to 40 ounces or roughly 20% of the blood volume at a time. The end point of bloodletting for many individuals was to induce syncope or fainting. And this is because of the Greek theory of the four humors. Again, in ancient Greece, there was a theory that all of human disease developed around what they called four humors: black bile, yellow bile, phlegm, and blood. They felt that these humors needed to be in balance for there to be no disease. Again, they thought that one way to balance the four humor was to drain blood from the body. Because of Galen's teaching, the practice of bloodletting continued for thousands of years and persisted almost until the 20th century, despite never being shown to help any patient. As a founding father of modern blood circulation, William Harvey ironically adhered to the practice of bloodletting. After suffering a stroke and developing speech impairment, he motioned for a friend to perform bloodletting on the veins under his tongue, hoping it would restore his speech. Of course, it did not work, since the main cause of his speech impediment was in his brain. This shows how deeply entrenched the concept of bloodletting and humoral therapy was in medical practice at that time. Even though controlling bleeding remained a significant challenge, Harvey's discovery of blood circulation laid important groundwork for future advancements. Chapter 3. Anesthesia. Having established a foundational understanding of human anatomy and blood circulation in the 16th and 17th centuries, the next major hurdle for surgery was pain management. The development of anesthesia was crucial in making surgery more humane and effective. For 300 years following the 16th century, there was virtually no progress in surgery due to the lack of anesthesia. It wasn't until the mid-19th century that this changed. On October 16, 1846, William T.G. Morton made history by being the first to publicly and successfully demonstrate the use of ether anesthesia for surgery. This crucial event took place at the Ether Dome at Massachusetts General Hospital. Another surgeon, Dr. John Collins Warren, witnessed the event and famously remarked, "Gentlemen, this is no humbug," which is a polite way to say that this is no bullshit. As an observer, Dr. Warren supposedly uttered these words to a packed operating theater while being blown away by this miraculous discovery. To him, that operating room was awfully quiet. The patient was not screaming and thrashing. As a result, the surgeon's operation must have been much more elegant, precise, and accurate. To every surgeon watching that demonstration, it must be a pivotal moment for them. The news of Morton's demonstration quickly spread from Boston to Dr. Francis Boot in England, who then informed Dr. James Robinson. On December 19, 1846, Robinson extracted a tooth using ether anesthesia. In 1847, Robinson authored one of the first textbooks on anesthesia, a treatise on the inhalation of the vapor of ether for the prevention of pain in surgical operations. Soon after, Scottish surgeon Dr. William Scott and British surgeon Dr. Robert Liston performed the first limb amputations on etherized patients in the British Isles. Liston commented, "This Yankee dodge beats mesmerism hollow," which can be translated as, "This American apparatus is more effective than hypnotism." He also described doing surgery with this new anesthesia substance in a letter to a fellow surgeon. With the advent of ether anesthesia, patients no longer experienced pain during operations. This breakthrough is considered one of dentistry's greatest contributions to the history of surgery. Before anesthesia, patients felt like condemned criminals awaiting execution, and if they survived the experience, the memory of it haunted them for the rest of their lives. In a letter to Sir James Young Simpson, a renowned Scottish anesthetist, a physician who underwent limb amputation described the ordeal, quote, "Suffering so great as I underwent cannot be expressed in words. The black whirlwind of emotion, the horror of great darkness, and the sense of desertion by God and man, bordering close upon despair, which swept through my mind and overwhelmed my heart, I can never forget. Those are not pleasant remembrances, and even now, they are easily resuscitated." Unquote. The discovery of anesthesia allowed surgeons to perform more complex and precise operations without the need to rush. However, its acceptance was not immediate. Like many things in surgery, new radical ideas can hardly triumph over conventional wisdom. And at that time, there is that conventional wisdom that pain was an important product of an operation because it invigorated the body. The patients were writhing, so they would be able to undertake and withstand the operation better. Even though it's hard to imagine this now, but there were people who didn't want to give anesthesia to their patients. Over time, the undeniable advantages of anesthesia in improving surgical outcomes and patient experiences led to its widespread acceptance, marking a significant milestone in the journey toward modern surgery. Chapter 4. Antiseptics. While significant advancements were made in understanding human anatomy, blood circulation, and anesthesia, the problem of infection remained unsolved as we moved into the mid-19th century. Surgeons did not yet understand the relationship between operations and deadly post-operative infections. Louis Pasteur's identification of bacteria in his work on the fermentation of wine laid the groundwork for addressing this issue. A couple decades later, an English surgeon, Joseph Lister, recognized the implications of Pasteur's discoveries and started to build upon Pasteur's work. Lister hypothesized that the living organisms Pasteur saw might be responsible for wound infections and the high mortality rates among surgical patients. Using a microscope, he proved that bacteria were hanging out all over the surgical incisions, and consequently, it would make sense for them to be the source of pus and infection. Lister's revolutionary idea was initially met with skepticism. The notion of invisible living organisms causing infections seemed far-fetched to many. However, Lister was determined to prove his point. He left England and traveled throughout Europe, demonstrating his findings and promoting the use of antiseptics. The European surgeons were more receptive to his ideas, and many even adopted his proposed antiseptic methods. Lister advocated for hand washing, sterilizing instruments, and using antiseptic sprays in the operating rooms. These things are pretty standard nowadays, so of course his techniques significantly improved patient outcomes. Despite the clear benefits, Lister's ideas faced resistance, particularly among older surgeons who clung to conventional wisdom. In 1876, Lister was invited to speak at the World's Fair in Philadelphia. This is a huge gathering of medical professionals. All of a sudden, the Americans decided to invite Lister over. They didn't believe him, but it was an interesting discovery, so why not? Lister came and delivered a compelling 4-hour lecture. After looking at all of the evidence, the American surgeons were divided. The younger surgeons embraced his teaching, while the older generations clung to their conventional wisdom and didn't believe in what Lister was talking about. Despite Lister's convincing evidence, not every discovery is met with a yes. Perhaps, admitting that your beliefs were wrong, your training was ineffective, and changing the way you practice were always hard. Lister's antiseptic techniques were validated by a tragic event a few years after his talk. In 1881, President James Garfield was shot in the back. This was now 5 years after Lister came to the US, but the doctors attending him were not buying into the antiseptic practices. They examined the wound with unwashed hands, introducing all sorts of bacteria. As a result, Garfield developed these huge abscesses throughout his body. Eventually, the infection was so severe that it spread to his bloodstream, and he passed away because of it. This is called sepsis, or bloodstream infection, a condition so severe that sometimes we have to keep septic patients in intensive care units for constant treatment monitoring. The aftermath of that incident is that there were many articles started appearing in the lay press and in professional journals saying, "Hey, you should have listened to Lister 5 years before." As an interesting aside, President Garfield's assassin at his trial came up with a brilliant quote. He said, "Yes, I shot the president, but his physicians killed him." Despite initial resistance, the tragic death of President Garfield spurred wider acceptance of Lister's antiseptic methods. By 1890, antiseptics were being used throughout America. This progress in controlling infection, alongside the earlier advances in anatomy, blood circulation, and anesthesia, laid the foundation for the effective and safe surgical practices we rely on today. Chapter 5. The Past, the Present, and the Future of Surgery. As we stand at the forefront of the 21st century, the field of surgery has undergone transformations that our ancestors could never have imagined, from full-face transplants that restore not just function but also identity, to highly precise pancreatic tumor removal and reconstruction of the gastrointestinal tract. Modern surgical techniques are pushing the boundaries of what is possible. Today, Surgeries that once required large incisions, extended hospital stays, and lengthy recovery periods can now be performed with minimal disruption to the body. To truly appreciate the profound evolution of surgery, let's take another look at leg amputation hundreds of years ago and today. In the past, amputation was a brutal and often fatal process, performed with rudimentary tools and without anesthesia or antiseptics. The goal was simply to remove a damaged or infected limb quickly to prevent the spread of disease, often resulting in excruciating pain and a high risk of death from blood loss or infection. Surgeons relied more on brute strength than knowledge, with a limited understanding of anatomy or surgical technique. In stark contrast, modern amputations are meticulously planned and executed with advanced tools. Surgeons carefully map the procedure, considering which tissues to cut and which arteries to ligate. Anesthesia ensures a painless experience, and sterile conditions are maintained throughout to prevent infection. Post-operative care now includes sophisticated pain management, rehabilitation, and the fitting of advanced prosthetics, allowing patients to lead active, fulfilling lives. This transformation highlights the incredible progress that has turned a once desperate act into a well-controlled and effective procedure. As we look to the future, it is clear that the field of surgery will continue to evolve, shaped by innovations we cannot yet fully envision. While we may not be able to predict exactly what the next century will bring, we can be certain that the journey will be guided by the same spirit of discovery and dedication that has driven the field of surgery for centuries. And that is it, everyone. If you enjoy this video, please don't forget to like and subscribe. I hope that you learned something new today, and I will see you next time.